It's a good thing that many people in the room know each other, because this is such an intimate setting that we're going to get to know each other even better because of the crowding in the room. But it's nice to see so many faces here with us this morning. I'm Dr. George Isham. I'm the one of the co-chairs of the Roundtable on Population Health Improvement. My other co-chair, David Kindig, is here as well. On behalf of him and myself, I'm very pleased to welcome you to this workshop on applying a health lens to decision-making in non-health sectors. So I'd like to let everybody know right off the bat that this session is being recorded and webcast. So the purpose for that, obviously, is to make a record of this conversation and dialogue and make it accessible to a much broader audience. But you should be aware of that personally. So you're going to be on camera and going to be recorded. It'll also aid us in making sure that there's an accurate record of the conversation that we have today. So I know that it's not only those of you here in the room, but many on the web, and I'd like to welcome all of those who may be joining us by webcast to today's discussion. The Roundtable on Population Health Improvement provides a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in social and political environment for achieving better population health. The need is clear and is well documented in a series of recent IOM reports, Institute of Medicine reports. And I think I'm most struck by the U.S. Health and International Perspective, Shorter Lives and Poorer Health, the report issued in January of this year. That report really points out that Americans have worse health than people in other high-income countries, and health disadvantage is pervasive across age and socioeconomic groups in this country. And I think it sets for us and the Roundtable the appropriate sort of challenge that we have in terms of working toward rectifying that situation. So we, as the Roundtable on Population Health Improvement, intend to step up and do something about that. We are a small, 29 at last count, but committed group of individuals drawn from a number of diverse backgrounds and armed with a very ambitious agenda. The Roundtable roster and bios are included in your meeting materials, and you can see who's on this group and where we come from, and then I would invite you to review them if you so choose. We on the Roundtable intend to catalyze urgently needed action toward a stronger, more healthful and productive society. To do this, we will facilitate and sustain collaborative action by a community of science-informed leaders in public health, healthcare, business, education, and early childhood development, housing, agriculture, transportation, economic development, and community and faith-based organizations. Our vision is that of a strong and healthful and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes such as improved life expectancy, quality of life, and health for all are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors, and will require a robust national and community-based policies and dependable resources to achieve it. So we see the opportunity in understanding better and fostering action in the important leverage areas that could make this agenda a reality, achieving this agenda a reality. And some of those leverage areas, as we've had our preliminary discussions as a Roundtable, we're early in our course as a Roundtable. We've only been really meeting for just a few months, actually, if you want to go back to the spring, April. But early in that series of conversations, we've set out a series of important leverage points that we might try to move the needle on. They include the identification and deployment of key goals and metrics for improving population health, ensuring the adequate allocation of resources to improve population health, the identification and deployment of effective science-based interventions that can actually move the needle, the development and implementation of high-impact public and private policies, one of the reasons we're here today to have a further exploration of in this workshop, the design and use of effective communication messages, and the acceleration of what I'm going to term a growing movement for health improvement in this country. So, it was Margaret Mead that said, "Never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, it's the only thing that ever has." So, this ambitious agenda put forward by this small and committed group of at least the Roundtable members is, I would hope, only the starting point for an accelerated group of activities that can be fostered by the dialogue and promoted by the products that we produce in this Roundtable activity. So, if you want to be part of this ambitious vision for improved health, please join our small, thoughtful, committed group of individuals that make up the Roundtable on population health improvement by visiting our website, where you will find listed at the bottom of the agenda the web address. And there you can find information about our meetings, our products, and you can actually sign up on the listserv and become like an official member of this small and committed group of people. So, among our major activities as a Roundtable, you know, our tools are different than the tools of consensus committees that have been so helpful in making recommendations for what we might do to address this problem. But our tools as a Roundtable are different from that. We don't make recommendations. One of our major activities is convening very key leaders and experts and others in workshops such as this one to discuss issues of importance to improving our nation's health. And what brings us together today is a discussion around policy formulation and the relationship between efforts in different sectors. Today's workshop will feature presentations and panel discussions on applying a health lens to decision-making in fields other than health. Our common recognition that factors beyond the doctor's office shape our health outcomes has grown considerably, but we need to do a lot more work to improve cross-sectoral collaboration and mutual understanding to alter health-influencing factors in our transportation, education, housing, planning, and other sectors. And I do look forward, I'm very much looking forward to today's discussion. And I hope that you've located copies of 2 discussion papers on today's topic at the registration table. Roundtable members should have those copies in their books and available to them, but for those of you who are not Roundtable members, they are available on the table, and they are very pertinent and very important to today's discussion. And I invite you to pick them up and read them and review them. So, if anybody has any questions or concerns about today's arrangements, the staff are wearing green name tags. I don't know if you can see the green from where you're sitting, but as you move through the day, please feel free to talk or ask your question or express your concern to any member of the staff, and they'll respond to your needs. My co-chair, David Kindig, who it's really very much a privilege for me to work on this project with, will come at the end of the day and conduct a conversation to sum up this workshop with all of you, but in particular the Roundtable members. And I want to remind you that as we move through the day, I want you to be thinking about and reflecting on what you're hearing and what the implications are for our broader objective of improving health. So you have an assignment, and it is to be thinking and recording your thoughts. We want to make sure that we capture those thoughts on the record and in this conversation, so that when we make a written record of it, and when people view it after the fact on the on the web, hopefully, that they can see that what we're learning and what you're reflecting about this conversation. It makes a much better product in terms of stimulating much broader action if we're very thoughtful in carrying out that assignment. So I want to make sure that I charge you to do that, and I hope to remind you of that same fact as we move through the day, as I make the transitions, and David will conduct that conversation toward the end of the day. So at this point, it's my privilege and pleasure, actually, to introduce Pamela Russo from the Robert Wood Johnson Foundation, member of the Roundtable, and she has been absolutely fantastic in engaging and putting together this workshop as chair of the committee. And so without further ado, you can find bios and backgrounds for everybody today in your materials. So I'm not going to be any more elaborate than that. It's my pleasure to welcome you to give us some additional orientation.
Thank you, Joe.